There are renewed calls for part of the Repatriation Hospital to be retained by the state government to ease pressure on our crowded hospital system. Critics say there continues to be little detail about plans to relocate some services from the site under the contentious Transforming Health agenda.
With the state government to detail plans for the Repat's future within months, critics say public health still has a role to play on the site.
In the last 13 years, $46 million has been invested in capital works on this site. We shouldn't be putting a wrecking ball through it. If you had a private hospital on this site, and we understand there are proposals for private hospitals, it might well mean that Door Park is the best location for Ward 17.
The Post-Traumatic Stress Disorder Centre will move to Glenside as part of the controversial Transforming Health plans, which were announced a year ago.
It's been a year of lack of communication with the medical people and the health professionals.
No one should underestimate the scope and the scale of these reforms. They are enormous. This is a once-in-a-generation reform and shake-up of our health system.
One firm decision under the plan is closing the Door Park Hospice and shifting palliative care to Flinders. A move which continues to rile the widow of former Southern Suburbs independent Bob Such.
He would have been disgusted. His by-election was December 2014, and then they announced they're closing the Repat in February. Now, people just laugh.
With the closure of the Repat looming, there remains concern there has still been no announcements about the future location of some of the services which are currently located on the site.
There's an enormous amount of work going on at the moment, working with clinicians about where those services will go.
Rory McLaren, 9 News.